Hi, this is Dr. Eric Thomas talking today about hair. There are a lot of interesting subtopics, and I'm going to get into them probably on other talks. Just a little background information, maybe a few examples. So hair grows actively for a while, and then it rests for a while. For example, the average, it varies a lot, on the scalp is about 18 months of growth, 6 months of not there, and then it starts growing again, except in hormonal hair loss. In hormonal hair loss, when the hair comes out, it either doesn't grow back or it grows back at a miniature status. And that's what happens, well, of course, most characteristically in men, here, and there, but it happens to women also. It's not limited just to men. Another thing about the anatomy or the growth pattern of hair that's kind of really important, and an illustration why it's important. Hair is usually not synchronized. In other words, one hair doesn't really know what the other hair is doing. So while you're always losing 50 to 100 hairs on average during the course of a day, there are others that are growing in. However, with hormones, especially in pregnancy, some women, not all, but some, tend to have the hair remain in their scalp for a longer period of time. It actually is not shed, so the hair could seem to be a little longer, maybe a little thicker, which is great. However, when the hormones of pregnancy end, or breastfeeding if it's prolonged that way, suddenly all of these hairs can be shed. We even give it a fancy name, telogen, which is the rest pattern, which is the stage of hair growth, effluvium, just like a river. So although women do not go bald, during the loss of hair, all the hair that was held in their hair during pregnancy does thin out. So that can be rather upsetting. So it's important to know these basics, because then we can reassure one another that the hair will grow back. Give it 6 to 8 months. Unfortunately, some people are taken advantage of and are told to use certain special things, certain vitamins. Well, if I wanted to say I could grow hair, I'd just find people who had this type of hair loss and sell them Dr. Thomas's hair restorer. No, I don't have one, sorry. And I could get pretty good testimonials a year later, because the hair is going to come back anyway. So, knowledge is power, and while we don't have all the answers, we'll share what we do have. So I hope you continue to listen. This is just the tip of the iceberg, and the other little talks will be more focused to individual ages, individual groups, individual conditions. There's one called alopecia areata, which you might have heard of, but that's the fairly sudden loss of either all or almost all the hair in a little circular area, and that's worth listening about, and we'll talk about that fairly soon. So anyway, here we are, Dr. Thomas, wishing you best health. Thank you for listening.